Hello, everyone. My name is Katie Stauffer, and I am a Senior Product Manager in our Product and Membership Design team here at the National Quality Forum. I'd like to welcome you to this program on prioritizing measures using NQF's new measure selection tool. We're glad you could join us, and we hope it will be informative for you. This program is made possible by the members of the National Quality Forum. Members are the driving force behind NQF's mission to advance measurable health improvements. Together, we do the work that enhances healthcare value, makes patient care safer, and results in better outcomes. Our presenters today are Nicolette Mijas, Director in NQF's Quality Measurement Department, and myself, Katie Stauffer, Senior Product Manager. I would also like to thank another member of our team who is on the call and was integral in helping us prepare for today's session. That's Funmilayo Idaomi. Just a few quick logistics as we get started. We do hope that you'll take an active role in the question and answer portion of the program. However, please help us stay on topic and refrain from questions or comments that aren't related to the information being shared today. We've muted all phone lines to ensure that unexpected noise doesn't interfere with the program. We'll be taking questions through the web interface and through the phone lines. There's instructions here. So if you are on the web, we are displaying instructions for how you can ask a question, and we'll display those again during the question and answer session as well. If you are only on the phone and unable to see the instructions, I'll prompt the audience when it's time for phone questions, and at that time you can hit *7 on your phone to unmute your line. And when you've asked your question, please hit *6 again to remute your line. And with that, I would like to hand it over to Nicolette to kick us off. Nicolette, you can unmute your line.
Great. Thank you, Katie. Good afternoon, everyone. This is Nicolette Mijas. I am a director in the Quality Measurement Department here at NQF. I'm very pleased to represent the team in today's presentation. This has truly been a collaborative effort across departments at NQF, including multiple project teams here, our consensus development process teams, the maintenance team, and so really would like to thank everyone for their contributions, and I also wanted to thank all participants for joining us today. We are really excited to be able to launch this tool. So there are a few objectives for today's webinar. The first is to share more about the purpose and the background of the measure selection tool. We will then provide an overview of the measure selection attributes, and then we'll move into an actual live demonstration of the tool and a couple of case scenarios. And as Katie mentioned, we will be sure to leave time for questions and a discussion portion at the end. I'd like to start off and begin by introducing why we think this work is important and how this work has evolved over time to the tool that we are introducing today. So NQF has endorsed over 500 quality performance measures that meet our standard endorsement criteria, including importance, which have sub-criterion of evidence and performance gap, reliability, validity, feasibility, usability, and use. 500 is a lot of measures. When searching for measures, organizations may have limited time and resources to review the different measures and their potential uses and their specifications and characteristics. And it can be quite difficult to identify which measures are most appropriate to use to best suit certain needs. Furthermore, organizations and decision makers need specific and actionable guidance to help identify measures that would be of most value to them. And so our goal with the measure selection tool is to really help stakeholders narrow the universe of appropriate measures based on individual user preferences. Helping stakeholders make sense of the NQF portfolio of endorsed measures has been a long-time strategic priority here at NQF. this initiative first started specifically focused on measure prioritization. And so the goal was to prioritize the list of measures included in the NQF portfolio. It involved several criteria, very similar to the current selection attributes that we'll be talking more about today, but it had a stricter scoring methodology that was applied by NQF, and this scoring methodology was used to rank measures based on specific numeric scores. And so when this approach was developed, it was vetted across various NQF stakeholder groups, including many experts across various NQF panels and committee members. And the feedback from the field was that it is true, there is definitely a need for a way to identify high priorities for quality measurement and improvement. But there was also feedback that the scoring methodology that was being used was making fine distinctions between measures that weren't always able to be justified, and that different stakeholders really have differing opinions of what measure qualities are most important. And so there was agreement that there is a need for stakeholders to be able to weigh their own preferences to easily identify measures that would be most appropriate for use for their specific purposes. So in 2019, we used this foundational work on prioritization, but instead refocused on measure selection in order to move forward with an approach that would offer guidance for selecting measures, but that used a less prescriptive approach. And so the goal is really to that this tool will provide users information to make informed decisions, to help inform decisions on how they are going about choosing measures. And so through the refocus on measure selection, we refined the measure attributes, we developed sub-criteria and guidance, and again vetted this with various stakeholder groups. We then applied these filters to all of the NQF endorsed measures. And then lastly, we integrated this tool on the NQF quality positioning system, or our QPS system. And that's really the tool that we are bringing you today. So before I jump into more of the content, Katie mentioned earlier that this program is funded and made possible by our members. I also did want to note that this initiative around measure selection is work that is internally funded and is made possible really by our NQF membership. Okay. So next we will move forward and provide more details about the tool and its measure selection attributes. So early on, we recognized the need to create a tool that balances competing factors. So for example, we wanted the tool to reflect the strengths of NQF endorsed measures, but we also needed to allow for enough differentiation for the tool to be useful for users as they go about selecting measures. So the attributes had to help distinguish one measure from another, or groups of measures from groups of other measures. So in other words, when the selection attributes are applied, we want to ensure that they are useful for narrowing the list of over 500 measures to a reasonable number of measures that users can look at more closely and evaluate the details of those measures. In developing the selection tool, we relied both on literature review, internal expertise, as well as a lot of stakeholder feedback to determine which measure attributes are most important, which measure attributes would be most helpful to our various stakeholders, and that would be most valuable if there was an easier way to sort measures using these characteristics. So in other words, we were trying to figure out which attributes of measures the field is most interested in when selecting measures to drive improvement and to address priorities. So also when determining which attributes we should include in this tool, we had to weigh how that information would be obtained. And so we needed to include attributes for which the information would be consistently available for all NQF endorsed measures. And we also wanted to make sure that the attributes and the associated concepts were well defined already or were able to be defined in order to tag measures accurately. And so the version of the tool that we are presenting today is really our version 1.0. It includes 7 measure selection attributes. And in the next 2 slides, we will go over each of these attributes in more detail. So on slide 10, you will see each of the 7 measure attributes that are featured in the measure selection tool. So NQF believes these attributes reflect key focus areas for quality measurement. And so the process that we use is that NQF tags measures to these attributes using a binary approach. So each measure that is endorsed after it goes through the endorsement process will be tagged as to whether or not it meets or does not meet each one of these 7 attributes. And so we plan to just go through each of these in detail and share a little bit more about what we are trying to get at with each of them. And so starting with at the top of the table, the first selection attribute is outcomes focused. This attribute considers the importance and the impact of measures that reflect a change in clinical status or health status. And so I think I'll start out by saying this is not to say that process measures or structure measures are less important. We recognize there's a role for process measures and structure measures in ensuring that evidence-based practices are being used and that the measures, those types of measures often represent the health system's effort towards systematic improvement. However, we also have identified that many organizations are looking for and selecting measures that focus on outcomes. The next attribute is highest opportunity for improvement. You'll see that we say highest because all measures that are endorsed by NQF have the opportunity to be improved upon. That is one of the mandatory criterion of their initial endorsement as well as the maintenance of their endorsement. However, this tag is meant to help differentiate measures that reflect the greatest opportunity for performance improvement. This can be based on either mean performance or performance disparities for certain populations. But it comes down to the decision of the standing committee, as NQF doesn't have specific cutoff thresholds that are used to determine whether or not there's a performance gap. The next attribute is patient and caregiver focused. So keeping the person at the center of the health system is key. So this is a category that reflects patient-reported outcomes or patient-reported outcome performance measures, but it also includes additional topics such as patient harm, healthy behaviors, continuity and coordinated care, and wait times. And these are examples of topic areas that are known to be meaningful to patients. The fourth attribute is coordinated and integrated care, and this tag identifies measures that directly reflect a collaborative and coordinated approach to healthcare, an approach that's known to improve the effectiveness, the efficiency, and the safety of healthcare provision. And so care coordination can have many definitions to many people. And so we do try to keep the definition broad, we use NQF definition from a previous framework project in this area, which describes care coordination as the deliberate synchronization of activities and information to improve health outcomes by ensuring that care recipients and families' needs and preferences for healthcare and community services are met over time. And so to supplement that definition, we also consider AHRQ resources that have additional definitions for defining care coordination. The next selection attribute is prevention and population health. This attribute reflects measures which focus on preventative care and population health issues. So for example, it includes measures that are focused on primary prevention or social determinants. For example, measures that fit into the category of cultural competency or access as well would be included in this category. The next measure tag or attribute is highly prevalent conditions. And the goal for this tag is to focus on measures that are related to pervasive and harmful conditions for both adults and child populations. And then the last attribute that is listed there in the table is lowest data collection burden. And this attribute is meant to identify measures that have minimum impact on clinical workflow and the lowest burden for collecting measured data. And so as I mentioned earlier, this is our first version of the tool. We recognize there are other important areas in advancing measurement. And so in the future, we do look forward to the potential expansion of these attributes and additional enhancements to this tool. So the next slide provides additional details about the guidance that is used by NQF in making these determinations. You will notice that some of the assignment guidance is more objective or subjective than other areas. This is in part due to the nature of creating this type of tool that does feature certain areas that are less able to be objectively defined. For example, it is easier to objectively determine outcomes focus because we can't use the measure type data than it would be to define a more nuanced topic such as the coordinated care or the patient and caregiver focused attributes. So the decisions that are made in tagging were and will be completed and confirmed by multiple internal experts here at NQF to maximize the consistency in tagging measures to these attributes. And those that do the tagging are using a standard set of guidance principles. So next, I also wanted to note that some of these attributes are based on information that's provided during the NQF endorsement process. For example, we use information that's provided for data source, measure type, and performance gap. But we did want to point out that this tool and the measure attributes are completely separate from the NQF endorsement process. Besides using select information from the measure's submission for endorsement to help inform our tagging, we wanted to note and make sure we are clear that these attributes do not affect the endorsement of any measures or NQF's endorsement process or any of the work of the Measure Applications Partnership or MAP. So again, we wanted to talk through at a high level the guidance that is used to tag measures to each of these attributes. So I will start with outcomes focused. I think this one is a bit easier since this attribute is assigned based on measure type. Then the next attribute and the guidance is associated for highest opportunity for improvement. So this attribute is based on the relevant standing committee's vote on performance gaps. So for a measure to receive this tag, we would be looking for the measure for a measure in which the majority of standing committee members voted high for performance gaps during the measure endorsement process. So moving on to the patient and caregiver focused attribute, you will see the subtopic areas listed there that would allow a measure to be tagged to patient and caregiver focused. Those topic areas include health-related quality of life, symptoms, experience, health behaviors, harm, financial stress, care coordination. So you'll see that care coordination is a characteristic of both the patient and caregiver focused as well as the coordinated and integrated care attributes. We did feel this was appropriate and it was purposely included in both, as it is important and related to both of these attribute areas. Also included in patient and caregiver focused are topic areas of wait times and patient and caregiver autonomy and empowerment. And so an example of a measure that would fit in that area include measures related to shared decision making. The next attribute is coordinated and integrated care. Examples of measures that are tagged to this attribute include those that focus on admissions and readmissions. I did want to note that measures that are tagged to this attribute must include the actual exchange of information rather than just the process of writing it down. Also wanted to note that palliative care measures are included under coordinated and integrated care. Since palliative care is whole person care and people can receive palliative care at any stage in their disease and continue to get other treatments, really with the goal of improving overall wellness. The next tag is prevention and population health, and the sub-criteria for this attribute include measures that address topic areas related to prevention and population health. For example, measures that consider the intervening that occurs before health effects occur. These can be measures such as those that focus on vaccinations, measures intended to alter risky behaviors, so those that focus, for example, on poor eating habits or tobacco or other substance use. And this tag also includes measures that are in the NQF population health portfolio and those that are specified at the population level of analysis, as these measures are meant to assess quality really across states or counties, for example. The next tag is related to highly prevalent conditions, and we gathered the list of these conditions from both the Centers for Disease Control and Prevention as well as the Institute for Health Metrics and Evaluation. We use those resources to inform the conditions related to this attribute, and this list includes measures that are related to the top causes of morbidity and mortality for both adults and children. And the last measure attribute, again, is lowest data collection burden. This attribute is based on the data source from the NQF submission. So measures, for example, that use paper medical record data or instrument-based data would not be included in this tag. We recognize that these measure types still serve important purposes and that the burden of collecting or the process of collecting that data can be worthwhile and is often the only way to collect certain data from patients. But the goal for this attribute is really to assist users in filtering measures for which it's easiest to collect the data needed. And so just to share an overall message would be that if a measure is not tagged to these attributes, it does not mean it's not a good measure. Quality performance measures serve many different purposes. These attributes are really meant to highlight the specific attributes that users are likely interested in and that can be used together in some combination for measure selection. So we believe there is a value in rolling up the more detailed information to a higher level and that it can be useful to look more holistically at these attribute areas during the process of selecting measures. So after NQF defined and vetted these attributes, we tagged the measures in the NQF portfolio, and the measure attributes are now available as a tool in QPS. And I believe many of you are familiar with QPS, but QPS is NQF's web-based inventory tool to help people find and select NQF endorsed measures. So to summarize, the measure selection tool serves as a resource for selecting measures that meet user needs. We did want to note that this tool is designed to work in tandem with filters that are already available in QPS. So importantly, you can still sort and filter measures by other factors, such as level of analysis, clinical condition or topic area, and target population, to name a few, I think, pretty useful additional filters used to identify and select measures. We also did want to note that the measure attributes are multi-select. So as additional filters are applied, the world of NQF endorsed measures will become narrowed to include only the measures that meet each of the filtering criteria. Using multiple characteristics to sort and filter the measures really provides a greater ability to search and compare NQF endorsed measures that are available in the NQF QPS or our database. So on the next slide, we have a visual representation of where the filters are located in QPS. So they are located there on the left side under Narrow Your Search section. And to share more about how the attributes can be used, I would like to, at this point, turn it over to my colleague, Katie, to do a live demonstration of the measure selection tool and to go through a couple of case scenarios.
All right, thank you, Nicolette. So as Nicolette said, I'm going to spend some time walking through a live demonstration of how a user might possibly want to apply the measure selection attribute. So before I do that, I want to outline what use cases we're going to be following. So one example of a possible user who might be interested in identifying measures for use is a hospital-based quality officer. So we're going to take the approach of someone working in a system that has recently expanded to include a new care facility specializing in pediatric care. And so as they're identifying what quality measures to use, they want to adapt their existing program to include measures that are appropriate for this new population that have been endorsed by NQF. And so as this user, I might specifically wish to find measures based on, measures appropriate for pediatric patients. And I might be looking for measures with a high opportunity for improvement. So we'll see how some of the different filters work together to narrow our list and our world of measures down to those appropriate measures for use. The second scenario we'll take a look at is a large purchaser organization who's looking to drive overall system costs down in their state. And they're looking both for new ideas and ways to track their progress. So they would be implemented across a wide group of care providers, so they need to be broadly acceptable and readily explainable. So as this type of user, I might be looking for measures that have a population-based level of analysis, that are addressing coordinated and integrated care, and might possibly have be addressing some of those highly prevalent conditions. So with that, I'm going to share my screen. So you should now be seeing QPS. Nicolette, can you let me know if if it is not displaying. But if I don't hear anything, I'll just move forward, assuming that you can see it. As you can see, this is the quality positioning system. This is the NQF database it's a publicly available tool of all the measures that have been endorsed by NQF at a point in time. So all measures available in QPS have been endorsed by NQF at one point or another, and they are updated as the measures are reevaluated and go through their maintenance process. So you'll see here that while we say that NQF has over 500 endorsed measures, in our database there are over 1,000 measures, because these are all measures that have been endorsed at one point in time. Some may have lost their endorsement over the years for various reasons. So we still display those. Just of note, the measure selection attributes are applied to only currently endorsed measures. So what you're getting when you apply the measure selection attributes is you're narrowing that world to currently endorsed measures. So you're getting those most updated measures when you're selecting them. As Nicolette mentioned, and as you can see on the screen here, the measure selection attributes have been inserted into QPS among the other filters that have been previously available. And they are designed to work in tandem with the other filters, and they use an and functionality, meaning that as you select additional filters, it will continually narrow the world of measures based on each attribute selected. So you're honing in more and more on possibly the types of measures that you might be looking for. Before I jump into those specific scenarios that I outlined, let's just talk a little bit about some of these other filters for people who are less familiar with our QPS system. So we have a filter based on measure type, so that's straightforward measure type there. And then down below the measure selection attributes, we have other factors here. So you can filter based on a clinical condition or topic area. You can filter based on care setting or target population. And so these have already been here and available. And then the measure selection attributes have been applied in there as well. So as when you're looking at our list of measures, you can see on the right-hand side of the page whether a measure is currently endorsed. Where a measure is no longer endorsed, you'll see a blank there, and you can click into a specific measure to view the measure details and get additional information and see the history of a measure and see when it has lost its endorsement, when a measure was initially endorsed, that type of information that you might find helpful. So as we look into the specific scenario, so just a reminder of the first scenario that we talked about, it was a hospital-based quality officer who is working at a system that opened a pediatric facility. And so I'm now looking for NQF endorsed measures that are appropriate for pediatric populations. So to begin, I'm gonna start with my target population, and I'm going to go down to these filters and select adolescents and children, so I'm getting the appropriate population in my measures. And we can see already that when I select that, I've narrowed the world from over 1,000 measures down to 179 measures. As someone who may be less familiar with the world of NQF measures, that might be overwhelming for me. I might not know exactly where to start, and starting with 179 measures sounds like a lot. So the next thing that I want to focus on are measures that do have a high opportunity for improvement. So I can make sure I'm addressing some of those with the highest opportunity for improvement and kind of narrow my world further. So with the application of that one attribute of the highest opportunity for improvement, I'm now narrowing the world to just NQF endorsed measures and those that have been deemed the highest opportunity for improvement that are also applicable to my population of the pediatric population. So I can stop there if I think, going through 33 measures, if I start to identify measures that that work with my program, and so there is still some work to do. Once you narrow the world of measures, you need to make sure that the measures you're selecting work well with the rest of your measurement program at your organization. But we're kind of bringing that focus in so that there's less to go through, and you wouldn't have had a way to filter that highest opportunity for improvement without these new attributes. It would have been a little more difficult to find out that information. So I'm going to clear that selection, and once it has reset, we'll go back to our full list of measures, and we're going to take a look again at that second scenario where I'm a large purchaser organization looking to drive down overall cost in my state. So starting with my level of analysis, I'm going to take a population-based level of analysis, selecting both community, county, or city, and regional or state. And again, I have now 220 measures to select from. That does include both endorsed and previously endorsed measures. And then, one of the additional factors that I'm looking for is because we're looking across a lot of different provider types, a lot of different facility types, I'd like to take a look at coordinated and integrated care. And each time I select a new attribute, the system will automatically apply it. So again, we've narrowed it down to 33 currently endorsed measures. For me, I'd like to narrow my list a little further. I'd like to find measures that are addressing highly prevalent conditions. And so now with a few simple clicks, I'm able to narrow the world, focus in on measures that address coordinated and integrated care, and also that are addressing highly prevalent conditions, which might help as I'm identifying new ways to focus on cost in my state. So now I've narrowed the world down to 14, and so that's a really, that's a nice place to start from. I can click into each of these measures, and as I do, I can find out more information about some of the details. I can see what other attributes have been applied to this measure, and so we do provide a lot of additional detail when you click into each individual measure. So as I said, there's still work to be done in selecting the appropriate measure once you've made this selection, and ensuring it works well with the measures that are already in your programs, ensuring that there's alignment. But I do have a much better starting point for my needs, and I'm able to find out additional information and explore further each of those measures and learn more. One other thing that is available, we went over in detail each of these measure selection attributes, and Nicolette spent a fair amount of time reviewing what they mean and how they're identified. We do provide a PDF download here in QPS. It's this Learn More link. If you click on that, it's going to download a document that gives kind of that chart look at what are the measures, what is the question that they're answering, and and what is some of the guidance for how the tags were applied. So we do provide some additional information because it can be helpful to have that information as you're selecting and working with the measure selection attribute. The other thing that is available in that PDF document is we provide an email address for you to reach out. It's qps@qualityforum.org. We do want feedback. We want to hear how, if this is helpful for you, if you have any trouble as you're using the filters or just need more information, please do reach out to us at that email address. We would like feedback. We'd like to know what are ways to refine this, things that people are looking for as they're using the measure selection attribute. So with that, I'm going to switch it back to the PowerPoint presentation, and I'm going to open it up for questions. I have displayed here the instructions for how to participate in the question and answer section. You can raise your hand by hovering the cursor over the slides. You can type in the chat box. If you're on the phone, once we've gone through some of the questions in the chat box or with raised hands, we'll open it up and I'll let you know when that is, and you can then hit *7 to unmute and ask your question.
So Katie, we have a question from Dr. Richard Antonelli from Boston Children's Hospital. He asks a question in the chat box. He says, I think the NQF definition of care coordination is very useful. Does NQF or this measure selection tool differentiate care integration from care coordination? If so, what is the difference?
Nicolette, I think you might be best to answer that one.
Sure, Katie, I can take that one. This is Nicolette from NQF. Thanks for the question. We thought it was important to capture both of these concepts. I will say that sometimes the terms are used somewhat interchangeably. I don't think that we have fully disentangled the nuance of these terms, but did recognize that they are both, important concepts. And so we wanted to be able to go beyond care coordination to capture things. For example, there's a need for greater integrated care, for example, for mental or behavioral health. That's something that the standing committee identified. So if measures were to address that care being provided, both mental and physical health care provided in one setting, and measures were able to capture that. We wanted to be able to capture that by the tool, not saying that a lot of those measures exist already. But I think the point of your question is that these are nuanced topics. I think it's actually a good suggestion for us to continue to explore really their differentiation as we continue to refine the tool.
Okay, our next question in the chat box is going to be from Karen Roth. Would patient safety, absence of harm, be included in the outcomes attribute?
This is Nicolette from NQF. So I would say that if the measure type is an outcomes measure or an intermediate outcome measure that is in the patient safety topic area, for example, healthcare-associated infection measures, I guess that could be harm, but it's more related to the measure type, so whether or not it's process versus outcome. So yes, if the patient safety measure was an outcome measure, it would be included under outcomes focused.
Okay, that's all the questions that we have in the chat box, so we can go to the phones. If there's folks on the phone that would like to ask a question, you can hit *7 on your phone to unmute your line and then ask your question. We'll give it a few seconds here to see if anybody does that. Okay, while we're waiting for more questions on the phone, we do have a question in the chat box from Charles Barr. He asks, when analyzing outcome measures, how do they get adjusted for baseline factors that might affect outcomes in addition to performance?
This is Nicolette again from NQF. I can take that question. And so as it might be less related to the selection tool we talked about today, but more generally, when outcome measures come through the NQF endorsement process, we require information about specific, factors that might need to be adjusted for, or that might cause the measure to need to be stratified due to those types of differences. So those are important types of characteristics and questions and discussions that are had by each of the standing committees as measures go through the endorsement process. And so to get that type of information, relating it back to the tool, you would have to go into the measure, look at additional information, potentially looking at their submission, or whether or not the measure was risk adjusted, could provide some additional information as to how those factors are considered for outcome measures.
Okay, we'll go back to the phones and see if there's anybody with a question on the phone. Remember, you need to hit *7 in order to ask a question. Our next question is going to be from Sarah Thurwell. If I wanted to find a PRO, what could be the advantage of using the new attributes as compared to the previous filter available for PRO?
Thank you, Sarah, for the question. So the filter related to, we're calling it patient and caregiver focused. So that would include patient-reported outcomes or patient-reported outcome performance measures, but it would also include topics that would be meaningful to patients that might not necessarily come from patient-reported data. So, for example, measures related to wait times or timeliness of care, for example, might come from other data sources than just filtering, looking specifically for pro-PMs. But I think it's a good, as a reminder, you can use both of these filters together. Or if you're specifically just looking for patient-reported outcome performance measures, I think using that specific filter in QPS is still a great option. This might be able to identify measures that address similar concepts, but not necessarily come from patient-reported data.
Okay, back to the phones. Any questions from the phone? Our next question is going to be from Nani Bodkin. Thank you for this clear presentation on the measure selection tool. Can you share a bit as to how you will evaluate the success of this tool? I'll take that one, Katie.
Yes. So one of the biggest factors that we want to take into account, and currently the way that we want to that will be. Sorry, I was thinking about something else right before you asked me that. The way that we are approaching measuring the success of this tool is getting feedback from people. So we do really encourage you to email us at qps@qualityforum.org with your feedback. I mean, we've already conducted some initial user interviews before the launch of this tool to get initial feedback, but that was before anyone had the opportunity to work with the tool. And so now as we're making it available publicly through our QPS system, we want to hear additional feedback, and then and from there, once we know that people are using it, we're going to be starting to refine some of that. So it's going to be based on the actual utilization and uptake of whether or not people are finding what they are looking for when they apply the new attribute. And just one more, I'm sorry, I was just gonna, with that question, it also brings up the fact of how do you get to QPS? If you're not familiar with how to get there, if you go to, you can either just go directly to QPS going to qualityforum.org/QPS, or if you navigate to the National Quality Forum homepage on our website, there is a drop down for NQF work, and if you go to find measures, that takes you directly to QPS.
Our next question is from Eric Clark. He says, I understand the measure selection attributes are assigned by NQF staff for use in QPS. Can you clarify who assigns the other measure attributes, such as national quality strategy, priority, data source, etc.?
This is Nicolette. I believe the other attributes when the developer submits a measure for endorsement, they usually have to provide that type of information, sometimes as like checking those boxes in their application for measure endorsement. But then that information is also vetted by NQF staff, particularly data source. That's a really important one that is talked about throughout the endorsement discussion. So the other attributes, sometimes they are assigned by developers, but then vetted and ensured that they're correct by NQF staff as the measures come through endorsement. And then just to add a little bit of additional information about how we will continue to monitor the success of this tool over time. I think Katie's exactly right. We really want this to be useful to users of QPS and those looking to select measures. I think we also want to look at the number of measures that are meeting each of these categories over time, and just to reiterate again that we are looking to enhance and refine the tool. So as we start to look at trends and hear from more folks that are using this tool, I think that we'll be able to determine how we can potentially incorporate changes to the tool or and enhance it further.
Our next question is from Colette Cole. Are you open to developer feedback about how a measure should be tagged? I'm only asking because I see a diabetes composite measure of ours that is completely untagged.
Absolutely, we can get in touch after the call, but as part of our process of launching the tool, we did try to get developer feedback, take this to our representatives from various different measure development organizations. So we would be happy if there are concerns or questions about how certain measures are tagged. We would be happy to have that conversation further.
And Katie, do you want to repeat that email address where people can get in touch?
Yes. The email address is qps@qualityforum.org, and it is also available in that PDF download in QPS. When you're at the measure selection attribute, there's a learn more link, and at the end of that PDF, there's a reminder of what that email is, qps@qualityforum.org.
Any more questions from the phone? We're nearing the top of the hour, so we'll probably wrap up here unless we have any more questions. Okay, it doesn't look like we do. So, Katie, you want to wrap us up?
Yes, thank you. I would like to thank all of you for joining us today. We hope that the information that was shared will be informative for your work with quality measures, with our QPS and with the new measure selection tool. Please be on the lookout for a brief survey about today's program. If you could take 60 seconds to give us your feedback, we'd really appreciate it. And for those of you that are members of NQF, I encourage you to tap into our amazing community of healthcare quality leaders on our online community, Member Connect. The recording of this program will be posted there shortly, along with a copy of the slides. This concludes our program, and on behalf of everyone at NQF, we wish you continued good health amidst these times.